Those northern Arizona hospitals already hit hard by coronavirus. First, the Navajo Nation, where they needed an extra field hospital. The patients, though, are now pouring over into Flagstaff, where they are rapidly trying to add capacity and prepare for a plan B for the surge. ABC 15 reporter Nicole Grigg live from Phoenix tonight with what Flagstaff Medical Center says they're doing. Nicole?
Well, they are seeing a greater need to care for critically ill patients, and it's to the point now where they say they're evaluating which patients are coming into the hospital, and some will have to go to other care facilities. A compelling visual by ABC 15. It shows the number of licensed hospital beds, 7,200 beds in the Phoenix metro area, with more than 700 ICU beds. But areas like Coconino County, there are only 300 beds normally and 41 ICUs. The Coconino Board of Supervisors warned capacity was coming on Friday.
So we are going to need alternative care sites to be able to handle the medical surge that we're already seeing and that we anticipate. And I believe both hospitals are reporting or projecting that they will be full by tomorrow.
Hit the hardest Navajo County. They have 160 hospital beds with only a dozen ICU beds. Access to testing is also hard for Navajo Nation. That's why TGen Labs in Flagstaff is working with tribal lands.
We're working with whoever needs testing doesn't have necessarily a great avenue either into the large commercial labs, or maybe the samples just can't go to the state lab for testing. That's who we're working with.
Flagstaff Medical Center is at 60% capacity now, and they say they're working to grow capacity and find space.
The Northern Arizona CEO shared with me on that is that they are nearing capacity for their ICU and critical beds. But does that mean, 30 out of 32 beds? I'm not sure until they give me those numbers.
TGen says they're focused on testing smaller communities like those tribal lands and increasing testing for healthcare workers.
We're certainly going into this dark tunnel together, but what we're seeing outside of Arizona and outside of the U.S. Is that this does have an end, and so there'll be a light at the end of this tunnel. We don't know when that'll be and what it'll look like.
And Navajo Nation saying today in a press release that they had another positive case and that they had to send that person here to the Phoenix area. When I asked why they were sent here to Phoenix and not Flagstaff, they said it was the family's choice on which facility they choose for treatment. Reporting live in Phoenix, Nicole Grigg, ABC 15, Arizona.